Good morning, everybody. This is Dr. Raul Rodriguez, and welcome to the Rodriguez Rejuvenation Show. This is a show here on Edge Radio where you get all the information that you don't get at your family practice doctor's office, especially how to look your best, how to feel your best, how to be your best. I'm joined this morning by my lovely co-host, Miss Sierra Ross.
Good morning, America.
Good morning. Good morning it is. Today we're going to be talking about a topic that I get a lot of questions about. I get a lot of people that come to my office to see me about. And that topic is liposuction versus weight loss.
Yes, Doc. Let us know what's the difference.
So we're going to talk about both. Now, you know I do a lot of liposuction. I do a lot of liposuction correction for people who have so-called bad lipos. Not necessarily bad, but they just have results that can be improved upon. So I have a lot of experience with liposuction in terms of helping people look better. But most of the people that come to see me for liposuction, not some, but most of the people that come to see me for liposuction want to look and feel smaller. Liposuction is not a body shrinking procedure. Liposuction is not a weight loss procedure.
Really?
Some people want a quick fix. They come in, they weigh 200 pounds, and they want to look like they did when they were 160. Liposuction can't get you there.
Really?
I could lipo you from head to toe, and the most that I could possibly get would be maybe 10 pounds, 12 pounds. That's 5 liters.
Wow.
And that would cost you a whole lot of money.
A
whole lot of money. Okay. So I'd like to clear up a few misconceptions about liposuction versus weight loss and when it's necessary. About 20 years ago, about 17 years ago, almost 20 years ago, I started a medical weight loss program in the practice to help take care of most of the people that came to see me for liposuction, but really they were too large. Okay? People don't realize that when you're large, liposuction is not a quick fix. Liposuction is a quick way to get some doctor to take your money, but it's not necessarily a quick fix to get you to the shape and size you want. And if you go online and you read reviews about me and our practice, you know we got excellent reviews because I'm always straight up and frank with my patients when they come to see me about what I can do and not do. It's not about the money, it's about satisfied customers for me.
Gotcha.
And when people come to see me in my practice, I look at them like they're my brother, my father, my sister, my wife, and I give them advice that's going to be best to get them to their goal. And many times when people come in for liposuction, like I said, they want to be smaller. They bring me a picture of 10, 15 years ago, a picture before they had the babies, a picture before they got divorced, or whatever the case might be that they blame on the weight gain. And they say, I want to look like this. Can you suck all this out? And they grab here in the belly and grab what they can feel. Now, when a person is large or overweight, and I'm talking about overweight, you're on the scale, you're weighing 15, 20, 30 pounds more than what you're supposed to, what you'd like to, what they don't realize is that the weight is not what you're grabbing right there around your belly. Okay, what you're grabbing around the belly is only the subcutaneous fat. That's the fat that's just right there under the skin, between the skin and muscle. That's all that you can grab. But when you're overweight, most of your fat, most of that weight, most of that 20, 30, 40, 50, sometimes 80 pounds that you see on the scale is not stuff you can grab on the outside. If you can't grab it on the outside, I can't suck it out on the outside.
So, Doc, just a quick question. What is the difference between liposuction and bariatric surgery? Or am I saying that right?
Bariatric surgery is liposuction. As I was just explaining, I can suck out what's between the skin and the muscle, what you can grab, okay? We can physically remove fat cells from that area. With bariatric surgery, you're not removing any fat cells from anything. You're just rerouting your insides so that your body can't absorb all the bad junk that you're eating. So you're not absorbing those calories that you've been putting in your mouth that got you big and fat. Okay? Now, that's if you want to have your intestines rerouted, that's an option, and you will lose weight. But if you have other options where you don't have to undergo the risk of general anesthesia, complications, a scar, not be able to eat certain things for the rest of your life, depending on what kind of surgery is done when they rearrange your insides, sometimes bypassing the stomach, just doing lots of different things that not the way God made your innards to work, okay? If you want to go through all that, the end result is going to be you're not going to be able to consume calories like you used to, and you will lose weight. So you will lose weight overall, you will lose weight in your entire body, and you'll get down to a healthier size, which is good. But what have you had to do to get to that? You've had major surgery, had major risks, major money, major downtime with recuperation, and you may have major permanent changes in what you can and cannot eat for the rest of your life just to stay at a healthier size.
Yeah.
So what's the alternative to that? Dieting, losing weight non-surgically. That's why I started a medical weight loss program in the practice, help people lose weight, get down to a nicer size, and not necessarily be skinny, but just get down to a size. I'd like to tell patients, okay, if you were coming into my office, Sierra, okay, what's a good weight that you think you look good, you feel good, and then people start getting ready to tell me, it's like, wait, that you can realistically maintain without killing yourself.
Doc, I like cheeseburgers. I don't know.
That's why I said that you can realistically maintain without killing yourself. So I always qualify my question with patients, and maybe, well, I like to eat this, but I think I can keep myself at 150, 160 pounds for a woman or a man. I can keep myself below 200 or who knows. But I let people declare what they feel is going to be the best outcome for them. Then I help direct them in that direction. Okay. Now, with the medical weight loss program, that we have all sorts of medical weight loss programs in my practice. We have the diet pills, which is phentermine. It's speed that they give at the diet clinics. I generally don't like those because they can have significant complications. But the program that I found that works as effective, even more effective than the diet pills, is something called the HCG diet. Okay?
What's that, Doc?
The HCG diet is a very strict, very rigid 500-calorie diet that I put patients on, and they're injecting a small amount of a hormone, HCG, human chorionic gonadotropin. That's why we say HCG, because human chorionic gonadotropin is a mouthful to say, okay? Yes. So we just say HCG. It's a lot easier to say it that way. And that is a hormone that you just inject just underneath your skin, like with using little diabetic insulin syringes underneath your skin. That keeps your metabolism active instead of shutting down or slowing down when you're only on 500 calories. Because if you had the willpower to only eat 500 calories on your own or eat very little like that, or if you were using the diet pills that a lot of the diet clinics will prescribe for you, the phentermine, the amphetamine, you won't eat. But every day that you don't eat sufficient calories, your metabolism gets slower because your body's saying, hey, Sierra didn't feed us very much today. She didn't feed us very much yesterday either. Ooh, we better start holding on to calories tighter tomorrow if we're going to survive, because we don't know when Sierra's going to feed us enough food again. Wow. So you'll lose weight. You have to lose weight, whether you do it on your own willpower by eating only 500, 300 calories, or whether you do it because you're jacked up on speed. Okay, you're going to lose weight, but your metabolism on the inside is getting slower and slower and slower and slower. Wow. So at the end of, let's say, a 90-day prescription for the amphetamine, your metabolism is so slow that even when you eat right, okay, not eat bad, even when you eat okay, your body's already holding on to calories so tight, the weight shoots right back up again, and you're fatter than you were before you got the prescription.
Oh, wow. So this is like a game of checkers and chess.
It's a game. It's a game. And that's why diet clinics are real popular, because people don't have to change their habits, don't have to change their lifestyle. They get jacked up on the 90-day prescription, and they're happy because they're losing some weight, but then they come back fatter 2 months later after they got off the pills to get another prescription. And taking your body through those changes is not healthy. Okay, with the HCG diet, we put you on a very rigid 500-calorie diet that consists of lean proteins and low glycemic veggies, things like spinach, celery, radishes, cucumber, and We give you the HCG medication that you inject into the skin, and that keeps your metabolism active. It keeps those fat cells giving up the calories instead of trying to hold on tighter to the calories. So your metabolism isn't messed up, and in fact, there's some theories that suggest that your metabolism is reset when you come off the HCG diet. Okay? Our program is 6 weeks, and in 6 weeks, we can speed up the amount of weight loss in a healthy way 3, 4, 5 times, sometimes 6 times faster than if you were just doing the right thing on your own. Okay? A rate of normal healthy weight loss is going to be about 1 pound a week. Okay? Might not seem like a lot, but
No,
a pound,
seems like a lot.
a pound a week, it's 4 pounds in a month. Oh, I lost 4 pounds this month. Nobody's going to get excited about that when you tell them that, okay? But if you do that same thing that you've been doing consistently day in and day out for 50 weeks, I gave you 2 weeks off for the holidays,
Oh,
okay?
well, thanks, Doc.
You would have lost 50 pounds in a year. That's huge. But most people get discouraged because they see the progress going so slowly. So with the HCG diet, some of our patients lose 5, 10 pounds the very first week on the
Wow.
diet. Now you say, whoa, look at this. My pants are feeling looser. My dress isn't quite so tight around here. And now you're motivated to continue doing the things that you need to do to reach your goal weight. And you're going to be more motivated to continue to do the things after you finish the 6-week HCG diet program to maintain your weight at the nicer size, whatever that size might be.
And healthier, by the way.
And healthier, by the way. I have a lot of patients that have a lot of medical conditions, high blood pressure, diabetes, things that often come with being overweight, okay? And if you have high blood pressure, you really shouldn't get put on speed because it makes your blood pressure shoot up higher and you can have a heart attack or stroke and die, okay? But I have a lot of patients with medical conditions, all sorts of medical conditions that are able to come in, diabetes, high blood pressure, bad cholesterol. They get on the HCG diet, they lose the weight in a healthy way, rapidly, under our supervision in the medical office. You come in every week, you check in every week when you get your new set of medicine for the week. And they can get off their blood pressure medicines. They can get off of their diabetes medicine. They can get off their bad cholesterol medicine.
Now, Doc, if I wanted to, let's say, for instance, have this weight loss surgery and I wanted to come to you about diet pills, can I gather all the medicines that I'm already taking, bring to your office and say, Doc, this is what I'm on?
Well, let's say if you want to have the HCG diet, not the weight
Yeah.
loss surgery, because that's the bariatric surgery.
Okay.
So the HCG is non-surgical treatment, okay? It's just, we give you these little medicine and those diabetic syringes, and you just inject it under your skin once a day. It doesn't even hurt. And then you follow the program that we've instructed you and given you written instructions to follow, okay? Now, I recommend for anybody that's coming into my practice, get all your medicines, all your supplements, get everything that you're taking, that you're on, whether it's for weight loss or anything else, put them in a little bag, and then bring them to the office. And we'll go over all those things. And I can tell you if you're using over-the-counter stuff, so you shouldn't use this, maybe you should switch to something else. If you're doing something you're not supposed to that's detrimental to your health, I'll inform you on that. And I'll look at your prescription medicine and say, if we get you to lose these 30, 40 pounds that the doctor tells you to go lose, but he doesn't tell you how to do it, we'll show you how to lose those 30, 40 pounds, and maybe you won't need that high blood pressure medicine.
Or the doctor anymore.
Maybe you won't need that cholesterol medicine. I'm getting there. Okay. Maybe you won't need the diabetes medicine. Maybe you won't need so many frequent visits to your family doctor. Now,
Save some money.
but you should still go for your annual exam to make sure that you're healthy. I recommend that. And I'm all about health. Unfortunately in our society nowadays, they have a lot of good doctors. And doctors are good people at heart, but we're trained to treat illness. We're trained to treat bad stuff. Well, my philosophy with Rodriguez Rejuvenation is let's keep you healthy, let's make you healthy, so we don't have bad stuff to treat. Okay, and that's a whole different concept in terms of healthcare. Instead of treating illness, let's promote wellness. Let's get your body working better, functioning better, looking better, so that you don't have to go to the hospital. So you don't have to go to the doctor as frequently. You don't have to pay as much money for those blood pressure pills or the diabetes medicine or the cholesterol pills or the anxiety pills, because we have things that will help even with those things as well. So that's very, very important. But let me talk to you a little bit about the liposuction. Once again, people want that quick lipo fix, you know. I talked about when liposuction is done, all we can do is contour the body. It's an external procedure to reduce the fat that's underneath the skin that you can grab. That's what people grab when they come to see me, is I want to get rid of this, okay? But they have a big old round barrel belly, but what they're grabbing is only just a handful of fat. It's not the whole belly. You know, they're not saying, oh, I want to get rid of this. No, they grab this and I want to get rid of this.
The little love handles.
Okay, but a lot of the fat when we're overweight, a lot of the calories are stored inside the belly. People don't realize that. That's called intra-abdominal fat or visceral fat. It's a fat that we normally have around our internal organs. Fatty tissue holds your liver in place, your spleen in place, the kidneys in place, the intestines in place. Fatty tissue is normal inside the abdomen. But when you're consuming a lot of calories, those fat cells in there start plumping up. You know, and then your belly gets bigger and bigger and bigger and bigger. Now, the fat that's outside the belly, outside the muscles, just underneath the skin, those also get big. And those are the ones that you grab, and that's the one that we can help you with liposuction. But the only way to decrease the intra-abdominal fat, the fat that's behind the muscles, inside the belly, the visceral fat, as it's called, around the internal organs, is by losing weight. And the HCG diet program that we have helps you do that. Once again, you mentioned surgery. Bariatric surgery will help you do that too. But you'll have to undergo an operation, hospital costs, recovery time, risks, and complications, and you're going to have your innards rerouted permanently in a way that may not allow you to enjoy the foods that you normally enjoy every once in a while.
Yeah.
Okay? So, in
And a
my
lot of
mind,
times it makes you sick.
it will make you sick. No, sometimes it will make you sick. Depending on the type of operation you have, you eat certain foods, you will get sick. You know, you'll have loose stools, you'll have all sorts of problems, and it will make you sick, but it'll make you slow your roll.
Yeah, because you're throwing up all day.
Exactly. So then we're going to talk about healthy ways to slow your roll too, because you know we focus a lot on what we do at Rodriguez Rejuvenation on the medical side, whether it's the weight loss or whether it's the liposuction. If a woman comes to me and says, "I want to have a smaller waistline, doctor, I just can get rid of all of this," the first thing I do is I get them on the HED diet program, help her lose 30 pounds, and now that intra-abdominal fat, the fat inside the belly, is going down. You know, I like to, people come into my office, I like to do a little analogy. I used to do it before I had to wear a mask, because now I have to wear a mask in my office because we follow, you know, COVID-19 precautions. So it's a very safe place to come, okay? So keep that in mind. I would have people look at my thin face, and then I said, does my face look fat? They say, no. But then I said, what about now? I blow up my face with air, okay? And I said, now, did I grow any fat? No. It's the pressure on the inside that's pushing my face out, and that's what happens around the belly, around the midsection.
It's a great analogy.
Your body can't push it out down here because you got hip bones. Your body can't push it out right here because you got ribs, but in between, we got lots of juicy there where the body can just inflate that belly and make the belly big. And that goes for men and women. So if you want a smaller waistline, whether you're a man or a woman, you need to reduce that intra-abdominal fat. The HED diet is one way we do it, but the other way that complements that we do in our practice is with hormones. Because sometimes, and you've heard me talk about this on the show, we discussed it, adding a little bit of hormones, like for a woman, just adding a little bit of testosterone will help her maintain a lean, fit body, not to mention other benefits, such as increasing mentation. Well, I'm getting there. Increasing your thought process, focus, clarity, concentration, mood, and sex drive.
You got to get to the juicy stuff, Doc.
And sex drive. And sex drive as well. I'm going to get to the juicy stuff right away, because I want to make sure people stay tuned all the way to the end, because I'm going to give you some tips and tricks that you can do on yourself at home if you're not ready to come in for the HCG diet or ready for liposuction.
What's
So
the phone number that they can reach you, Doc?
they can always call my office number. It's an easy number to remember. Put it in your phone, program it into your phone. Rodriguez Rejuvenation. That's 713-523-2500. That's 713-523-2500. And check us out at Rodriguez Rejuvenation, Nation.com. You can also check us out on Facebook at Rodriguez Rejuvenation. And also you can check us out on Instagram at Rodriguez Rejuvenation too. We're constantly loading up information that's helpful information. We have before and after pictures. We have tips. We have videos. So it's a wealth of information for you so that you can get up on a lot of things that we just can't cover on the shows here every single week. So that's a good place. Okay?
Yes, sir.
Now, one of the things that, like I said, we talked about the fact that people like quick fixes, and to really get long-term changes, you really need to make lifestyle changes. And lifestyle modifications is the most important thing in terms of maintaining your weight. We can help you lose the 30 pounds in 6 weeks of the HCG program. But what about maintaining your weight? We have people keep a journal, a diary, where they record every single thing they eat. And the beauty of that is, you bring that with you every week. And Chantel, my assistant, she'll grade your little journal, your daily food journal, just like a school teacher grades papers and say, oh, you didn't eat this, you did that, you shouldn't eat that, you should move this protein to the day, to the morning. So she'll coach you on what you need to do to learn a different relationship with food.
Nice.
And that's what it's all about if you want to maintain a leaner, more healthy weight. We have other things that when you become a patient of Rodriguez Rejuvenation, we'll talk about other things we can add on that also help support it, whether it's talking to you about certain types of exercise programs, whether it's talking about hormones, getting your hormones optimized, not normal necessarily, but optimized. And there's a big difference between optimal and just normal. You may be in a normal range on the lab, and the lab range may be from 0.45 to 4.5. You go get a test done at your regular annual physical, and just if it's 0.48, they say, oh, you're normal, you're fine, out the door. But you still feel like crap.
Wow. Yeah.
Okay? So a normal, instead in that range of 0.45 to 4.5, for you may be 4.2 instead of 0.48. You're still in the normal range, but now you're feeling better.
Yeah.
Now you're back to the self that you always wanted to be. And those are the things, a little tweaking that we do when you become a patient, when you're on any of our programs or coming to see us on a regular basis at Rodriguez Rejuvenation. So,
Well, Doc, one of the things that I'm highly impressed with about your practice in your office is that you never leave your patient to deal with anything by themselves. If you have an issue with your hormones, you say, hey, listen, we'll also coach you through that. If you want to know about the shampoos and skincare, hey, bring all your products in. You help us with that. So it's a great asset to be your patient because you provide so many different coaching services.
Absolutely. And our patients aren't just patients. Our patients become friends. Many of our patients become like adopted family, okay? and I've had patients that have been seeing me for 20 years or more. And because we really care. We care about about the well-being of every single person that comes to seek our assistance, okay? Now, before we leave, I'm going to give you some little tips in case you don't want to do the HCG diet or in case you don't want to get your lipo done yet. I'm going to tell you how you can get to a nicer size at home. I'll give you 3 little tips, okay? One is to detox your home.
How do you
and
do
by
that?
detoxing your home, that means detoxify your pantry and your refrigerator. Eliminate everything that comes in a box, a package, or in a can, okay? That will eliminate all processed foods with added sugar, added salt, etc.
Wow.
Number 2 is eat with your non-dominant hand. If you're right-handed, eat with your left hand. That slows down your roll, and then the food that you're putting in your belly will start registering, letting you know when you're full and you don't overeat, even though you may be eating bad stuff.
That's a good trick.
The last trick is what I call the Dr. Rodriguez Aqua Fiber Diet trick.
Okay.
And that's get yourself some Metamucil or some citrus cells, all those fibers, laxative fibers, take with a big glass of water 30 minutes before your meals, before your biggest meals, usually lunch and dinner for most people. What that does, it begins to pre-stretch your stomach. It stretches the nerve endings in your stomach called baroreceptors. So when you sit down to eat 30 minutes later, you're already feeling halfway full and you eat less.
Okay.
So those are my 3 tips for the day. Detox your home and your pantry and your refrigerator. Eat with your non-dominant hand and use Dr. Rodriguez's aqua fiber diet trick.
Love it, and love it. Doc, thanks. You just come through every week with these healthy gems. One more time for the listeners that's just possibly tuning in. Where can they find you again?
They can always find me at RodriguezRejuvenation.com and call the office. We like to talk to people. You know, people do a lot of texting. We do a lot of virtual stuff on the office, but we like to hear your lovely voices. Call the office at 713-523-2500. That's 713-523-2500. Easy number to remember. Look us up, Rodriguez Rejuvenation, on the internet, Facebook, and also on Instagram.
Thank you. And you guys can always catch us here every Wednesday on 1540 AM and 101.7 FM on Edge Radio Network. And up next is Conscious Conversations with Sierra Ross. So we'll see you next week. Thanks, Doc.
Thank you. This is Dr. Raul Rodriguez.
And this is your girl, Sierra. We want to invite you to join us every Wednesday at 11 a.m. for our new show, Rodriguez Rejuvenation.
I am a board-certified cosmetic surgeon, and each week we will discuss new breakthroughs in medical technology, erectile dysfunction, vaginal rejuvenation, natural breast augmentation with your own fat.
So you're saying that you can take the fat from my belly and increase my breast size?
Exactly. Or your buttocks instead. Learn more at RodriguezRejuvenation.com.
Tune in every Wednesday at 11 a.m. on Edge Radio, where the truth still matters.
This is KGBC, Galveston, Houston, 1540 AM, and K269GS, Pasadena, 101.7 FM.
1540 AM and 101.7 FM Houston, Pasadena, Clear Lake, Galveston.
145 over 92.
180 over 111.
I had a heart attack and a cardiac arrest and then a stroke.
Your blood pressure numbers could change your life. Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
Now I'm trying to get better, stronger than ever.
Brought to you by the American Heart Association, American Medical Association, and the Ad Council.
1540 AM and 101.7 FM. Edge Radio.
Business owners, thought leaders, when you're ready to connect with new customers, your radio station has the edge you need to succeed. Call 281-744-0446. For more information, call 281-744-0446.
This is Dr. Arango with Arango Chiropractic Clinic. Do you wake up with stiffness and chronic low back pain? Do you have swelling and limited movement in your neck, hips, knees, or ankles? Do you feel fatigue and chest discomfort when breathing? These are just some of the symptoms of ankylosing spondylitis, or AS. Ankylosing means joining together. Spondylitis means swelling of the body of the vertebrae. Manipulative therapy performed by osteopaths and doctors of chiropractic is an effective method of treatment of ankylosing spondylitis.
Contact us